Make sure the environment is safe for the rescuer and the victim. Determine the presence of consciousness. Call out to the victim. For example, if the patient's name is unknown, "Sir, what's wrong with you?" Pat on the shoulders and state, "There is no consciousness." Look at a certain person and tell him, "Call 103, call an ambulance with a defibrillator and follow my actions." Determine the presence of breathing by the principle I see, hear, and feel. Identify the symptoms of cardiac arrest, that is, the absence of the pulse on the carotid arteries from both sides. Respiration and pulse should be assessed for no more than 10 seconds. And say, "I proceed to cardiopulmonary resuscitation." Lay the victim on a firm flat surface on his back, hands are pressed along the trunk. Raise the lower limbs at 30 degrees. Release chest and abdomen from tight cloth. Place the palmar surface of one hand on the lower third of the sternum, but not on the xiphoid process. The second hand is on the top of the first hand in the form of a lock, at the right angle to the chest. The fingers of the lower hand shouldn't touch the chest. Perform compressions on the sternum, trying to shift it to the spine at least 5 cm and no more than 6 cm. Compression pressures from 100 to 120 per minute. The maximum breaks between compressions are 10 seconds. Make sure the chest expands after each compression. Proceed to artificial ventilation of the lungs using the mouth-to-mouth method. Ensure airway patency. Exclude a neck injury. Examine the oral cavity. Free the oral cavity from foreign bodies. Carry out the triple maneuver by SAFAR. Triple reception of SAFAR. Tilt the head back. If a neck injury is excluded, put one hand on the forehead, another one under the neck. Thrust the lower jaw forward with a hand which was under the neck. Open the mouth. Further, when performing ventilations, it is necessary to hold the lower jaw. Conduction of artificial ventilation with 1 and 2 fingers of the hand located on the forehead. Close the victim's nose. Take a deep breath, tightly covering the victim's mouth with your mouth, and exhale evenly into the victim's mouth. The volume is about 500 milliliters. Moving away from the mouth, wait for the end of the exhalation and repeat the inhalation. 1 inhalation, 1 second, 1 exhalation equals 2 seconds. Carry out a heart massage in combination with artificial ventilation in the ratio of 30 to 2, 30 compressions for 2 ventilations, which is equals to 1 cycle. 5 cycles of cardiopulmonary resuscitation equals to 1 CPR period. After one period of CPR, stop analysis. The pulse on the carotid arteries is determined, breathing is present. Resuscitation measures were successful. The patient is shifted to the recovery position and is hospitalized in the intensive care unit by the ambulance. If the pulse on the carotid arteries is not determined, cardiopulmonary resuscitation is continued for 30 minutes or until blood circulation and respiration are restored.